Hi guys, today I want to talk about the use of antibiotics after a knee replacement, and specifically Levaquin. Levaquin is a really strong, powerful antibiotic, does lots of good things. Surgeons use antibiotics a lot of times after surgery as a prophylactic to prevent any infections that you may have. But one of the side effects with Levaquin is that it can cause tendon ruptures, specifically the Achilles tendon. So your calf muscle comes down to the back of your heel, and the tendon back there behind your heel is the Achilles tendon. It's about the size of your finger, and you can get ruptures there. I had a guy recently that had a knee replacement. We were going along fine, and he complained about this pain in the back of his calf and his Achilles tendon, and felt around back there. He had a little lump. Happened to be going to the doctor the next day. I didn't know he was on, he had taken Levaquin, and came back from the doctor, found out that he had a partial tear of his Achilles tendon, and found out that he was on Levaquin. So we backed off, didn't do some of the more advanced exercises we were going to do, and gave him a chance to heal and get through that, and we were able to get back on track. However, had we not known about that, had we not really paid attention to it, he could have torn his Achilles tendon and ended up back in the hospital with another surgery. And that's no good for healing and recovery. When I used to work at the hospital, I had a couple patients that had happened to, where they had had their knee replacement, went home, came back in within 2 or 3 weeks with an Achilles tendon rupture and had to have another surgery, which set them back, and had we known about that beforehand, might have prevented that. So just something to keep in mind. Not saying that you shouldn't do that, but make sure you discuss it with your surgeon, and really make sure you discuss it with your therapist, whether you're receiving home care or you go to the outpatient clinic 6 weeks after surgery, after you finish home care and you're in the clinic and you've got a new therapist. Always make sure you let them know, hey, I took Levaquin and it's been 6 weeks, just so they know, to make sure that they are aware of that whenever they're prescribing your exercises. So hopefully that helps. Hopefully it gives you something to think about. If you got any questions, let me know. Thanks.